today was someone that came to me 20 years ago for a hair restoration procedure. And back then his hair was brown. He was working, and all we had to offer was the strip procedure. And so we performed a strip procedure for him 20 years ago. He was a Norwood 3 vertex, and it filled in quite nicely in his frontal area and in his crown area, and it lasted. You know, some individuals will have more progressive hair loss. Some individuals will remain somewhat stable following hair restoration, and this is an example of how a hair restoration procedure done properly 20 years ago can still add coverage and be natural today. And of course, done well over 8,000 strip procedures during my lifetime, and I was very good at them. He had very nice healing in his donor area from the strip procedure, great coverage. And so he came back and he told me that he many times tells his wife that this was the best money he ever spent on himself to get his hair back. And he's enjoyed having it. He came back in for just a little touch-up, a little dusting in the crown, even though he maintains pretty good coverage from a procedure done 20 years ago. And it also shows that I see patients all the time who come in and say, you know, I had a transplant 10 or 15 years ago or 12 years ago, and they didn't have good quality hair transplant work back then. So that's why I look so pluggy and unnatural with a big wide strip scar. And that's just not the case. Good quality hair restoration surgery has been around literally for well over 15 years. And I know we started doing it in the early 90s, around 92, 93, with the small grafts, even though I was a young physician then. So good quality work's been around. It's just most physicians take about 10 years to acquire the desire, actually, to change and perfect their skill set.